Hello guys, quick video. Just came back from my oncologist, who I have to see monthly, which is more regular than most cancer patients would have to see their doctor. But because I'm on the research study, I have to see him a lot. And I always joke with him about how he knows my body and has seen my body more than my girlfriend, and I get more action at his place than even at my girlfriend's, and I feel comfortable with him after all these years. Anyway, every time I'm there, I mention to him the most distressing side effect of having been taken off all my hormone replacement therapy that I was getting after my original hysterectomy back when I had cancer in 2004. And now that some dust is settling, it's been probably 3 months since my last chemotherapy, we've got more time to discuss it, and we talked about it, and he came up with an idea. And he said, Viagra. Let's try Viagra. And I was so excited that he brought this up and suggested it. Well, within a minute, he and I both realized that one of the secondary diagnosis that I have has to do with a dysfunction in my autonomic nervous system, which basically means that my vessels in my entire body dilate abnormally and are unable to contract enough to keep my blood pressure up, especially when I'm hot or exercising or stand up suddenly. It's like orthostatic hypotension, but it can happen when I'm just standing for a while, doing nothing. Anyway, the bottom line is you can't give Viagra to a patient who has low blood pressure. So I'm taking medication to bring my blood pressure to normal, and it's working. If I take Viagra, it will plummet. So it's a contraindication to taking Viagra, which is not funny at all, but when that drug first came out, we had a lot of patients that were just falling over, croaking, and it had to do with the fact that there were a lot of older men who've lost their ability to get an erection, were taking Viagra, but they were also on nitroglycerin for chest pain. Well, when you give nitroglycerin to a patient who's taken Viagra, their blood pressure plummets, and they were dying. So you can't combine the two. So not that I'm on nitroglycerin, but I already have low blood pressure. I'm taking medicine to raise it. Now we finally have an idea to take Viagra, and I can't take it. So, we talked about testosterone, and at this point he really basically, he's cool because he'll roll it around and we'll talk about ideas and talk about research and data that each of us have found, and he just can't sign off on it, even any amounts at this point. So, the conversation is still, I think, is something that we're going to continue to have over the months and the years that we're together. And, at some point, here's the thing. I'm on the study right now. I'm on this research study of this experimental drug that is showing remarkable results. I got another report from my chemo research nurse today. I saw her yesterday and today. And I also saw another oncology nurse today who I've worked with, and they've all said that all the reports are coming in extraordinarily positive, that this new PARP inhibitor is really having an amazing effect on keeping patients of ovarian cancer in remission. I think they might also be doing it on breast cancer, but regardless, it's probably going to come out and be a drug that's going to be available. But I just had to tell you about the Viagra. So I got all excited, but I can't do it. So anyway, I just have to say it was really cool to be able to sit in the office and discuss with my doc. He's so cool. You know, the problem that I'm having with a lack of libido, and it's not just me. I've talked to hundreds of patients who, like myself, you notice how I don't say, I've talked to other girls, other women, because I hate it, it's just the way it is. You know, it's just the way it is. Men don't get ovarian cancer. Well, one did, but you understand what I'm saying. Biomales don't get ovarian cancer. Biomales do get breast cancer, though, especially if their testosterone levels are high, which is what he told me today. No, that's not what he said. I take it back. Retract. Biomales get breast cancer, and 95% of the time they're BRCA positive, BRCA positive. That's the gene that I had that, if you look it up, you'll see it's a genetic mutation that makes individuals more likely to get certain kinds of cancer. And in my case, I was BRCA positive, BRCA1 positive. So, interesting little tidbit. Biomales who do get breast cancer are almost always BRCA carriers. Anyway, I guess that's it. I seem all happy and excited, and I didn't get to get any hormones, but it's still, I don't know, it just makes me feel good to be able to discuss these things with him. When I'm off the research study, maybe there'll be some more research by then. Maybe I'll have to make a decision at that point about the quality of my life versus the risk I might be taking of having a recurrence. So if I get through the first 2.5 years, the chances are better that I don't come out of remission, but you know, we'll see. Anyway, that's the story, and I'm sticking to it, and I hope you guys are well. Peace out.